We developed the Social Sector Wellbeing and Resilience Hub in response to the almost normalised trend that people who work and volunteer in the social sector are often on a spectrum from stress to anxiety, crisis, trauma, or burnout. When we say people who work, we mean leaders, employees, and volunteers. And when we say the social sector, we mean charities, not-for-profits, and social enterprises. Our purpose is to mainstream and normalise good mental health for those working and volunteering in the social sector, to strengthen their work now, and also to create resilience to face future challenges. We do this via capability building, providing resources in the Wellbeing Hub for free access to all organisations in Australia and internationally, a little similar to the Digital Transformation Hub or Justice Connect's not-for-profit law. We are also setting our sights higher to looking at the structural constraints or structural causes of the wellbeing deficit in our sector, and working with partners, intermediaries, peak bodies, member groups, and grant makers to bring a wellbeing lens into our sector, a little similar to the climate lens or the gender lens that many are already familiar with. The organisation taking carriage of the Wellbeing Hub is the X Factor Collective, a dual entity, social enterprise and charity. The hub is being delivered out of the charity, which has DGR status, but we share the mission to improve the mental health and wellbeing of the social sector in Australia. What's the evidence base for the wellbeing deficit? Well, in 2020, the X Factor Collective Foundation conducted the Reset 2020 Impact and Need National Research Study funded by Equity Trustees. It ran 2 extensive questionnaires to over 300 social sector employees and volunteers. And one of the questions in phase 2 study was, how often did you feel that you're not taking care of yourself, frustrated or exhausted, stressed or anxious? And the results here show that over 40% of individuals working in our sector are feeling these things often or always. Rolling disasters and the pandemic have compounded the mental health deficit in our sector and creating a new burden of work on top of a already stretched workforce. This poses a risk to service delivery. Indeed, the ACOS demand snapshot in December 22, in that 97% of social sector staff said that their main service could not always meet demand. So I'd like to introduce you to the Social Sector Wellbeing and Resilience Hub and take you on a tour of Stage 1, which has been funded by the Lord Mayor's Charitable Foundation. So the Wellbeing Hub targets both social sector organisations, being not-for-profits, charities and social enterprises, as well as advocating for sector change. Organisations are invited to start here by taking an organisational health check. The organisational health check is a questionnaire that covers the 6 pillars of wellbeing and resilience, these 6 pillars down here. And organisations are asked to fill out the questionnaire about what practices they've already got in place in these pillars. Once they finish the questionnaire, they're emailed a confidential report which outlines what they've got in place, where they might improve, and helps them prioritise which of these pillars to start with. As mentioned, the hub is designed for time-poor people, so we've curated pre-existing resources that we see as being both high quality, relevant, and really appropriate for the social sector. And where we couldn't find these resources, we've actually built them ourselves. So an organisation will get the health check, see that, maybe I need to start in prevention, I've got to get legally compliant, that's the first things first. And then they will go into toolbox of prevent, and in the toolbox of prevent, there are 3 modules. They might go into the work health and safety module, And each of these modules has curated pre-existing resources. So, for example, there's a legal rights and responsibilities resource from Beyond Blue and Heads Up. And where the resource didn't exist or we felt it needed to be built, we've actually created new resources, such as a guide and checklist about leading a psychologically health and safety workplace here, or a video about what is a psychologically safe workplace and how to create one. So each of the modules comprises a mixture of our new resources and pre-existing high-quality resources created by approximately 28 different wellbeing organisations. So here we can see we've also got WorkSafe Victoria and Safe Work Australia. So the organisation can really work at their own pace to implement the pillars and the toolboxes. There are 11 modules covered under the 6 pillars. So the 6 pillars of prevent, protect, educate, enhance, crisis and recovery, and then 11 modules, because some of the pillars have a number of different modules in them, such as within protect, we've got governance and board reporting, where we're talking about what is wellbeing governance, leadership practices and support mechanisms. So for example, if I click on governance and board reporting, I see some information about this generally, and then a number of resources, some of which we've penned ourselves and developed ourselves, and others which are pre-existing. In fact, this one most of them have been created by us, but we've got them developing a workplace mental health strategy by Heads Up in this one. So the organisations can work at their own pace to go through the toolboxes and the modules. If they need help to do the health check or to get some really tailored advice for their specific circumstance, we'll be building them out an expert bar, which is a little bit like the digital transformation expert bar, and quite innovative in our sector in that an organisation can get on-demand, bespoke and small bursts of support. So they can book in for 15 minutes, 30 minutes, 45 minutes with an expert in this area, perhaps in crisis or in protection or prevention, policy risk, all the different modules that we've created, and get specific support for their needs. And the other thing I wanted to show you is the advocacy tools. As mentioned, we're trying to shift the bar not only at the organisational level, but also at the sector level. And so we've curated resources to support organisations with things like building resilience. So we've got some resources here about, quite aside from the organisational level, which we've got the pillars are covering, what else can you do to build resilience in your not-for-profit or social enterprise? As well as creating new resources. So for example, we've created a new resource to support grant makers with funding that really supports the wellbeing of the organisations that they support. Okay, so that's a little tour of the hub. Please don't hesitate to contact me if you've got any questions or want to see something in a bit more detail. But we just wanted to show you where we're going with the toolboxes for the organisations and with the advocacy to shift the dial more broadly. Thanks for your time.